Hey, what's up, guys? This is Dr. Kotei, the primary care physician you can trust, breaking down the topics you care about in a way that you can understand. The rates of COVID-19 infection in this country are higher than they've ever been, and there's a lot of different reasons for that. But one thing that stands out to me is the fact that I still see a lot of people in public places who decide not to wear masks, either to protect themselves or to protect others. So in this video, I'm going to talk about why this very simple measure is something that we must do as a country if we're going to get through this pandemic. First of all, I would like to start off by saying that I get it, because at the beginning of this pandemic, there were a lot of mixed messages. I mean, you even had the Surgeon General tweeting, telling people to stop buying masks. And I think at that time, the fear was that, because there was a limited supply, if the general public bought up all the masks and there wouldn't be enough for healthcare professionals and sick people with symptoms who we knew definitely needed to have a mask. But a lot has changed since then. We realized that in places like China, the universal use of masks helped to flatten the curve. Production and supply of masks has increased significantly. And now we actually have real evidence that the use of masks can help slow down the spread of COVID-19 infection. A systematic review and meta-analysis published in the journal Lancet in June compiled multiple smaller studies done in Asia and the US that look at the effect that physical distancing, eye protection, and face masks have on the transmission of COVID-19 and other similar viruses. This is kind of a busy chart, but basically they took a bunch of small studies and looked at people who were exposed to those viruses. They calculated the percentage of people that got infected that were wearing masks and compared it to the percentage of people that got infected that were not wearing masks. If the outcome of the data fell on the left side of this solid line, that favors those wearing masks. Overall, the study showed the use of face masks greatly reduced the risk of transmission of COVID-19 and other related viruses. But even without that data, it is common sense, right? I mean, if you think about an infection like the flu, people that are infected with the flu are visibly sick and symptomatic, so you can easily identify them and keep your distance from them, and they're most likely going to try to keep their distance from you. But with this virus, because it has such a high rate of asymptomatic transmission, you pretty much have to protect yourself from everybody that you come in contact with, and you also have to protect them from you because you could have the virus and not even know it. Plus, you have heard the term "say it, don't spray it" before, right? Well, when we talk about this virus being transmitted from an infected person through close contact and respiratory droplets, that's the spray that we're talking about. And masks block that. So N95 masks and surgical masks block that. And even cloth masks can serve as a physical barrier to block that spray that comes out of your mouth anytime that you talk. Now, it does get tricky when you talk about the virus potentially being airborne, because that could mean that there are even smaller particles floating through the air that can get through a cloth mask easily, and in some cases even through a surgical mask. And that's where things like N95s for healthcare professionals and face shields come in. The meta-analysis that I mentioned earlier showed that eye protection was effective, and also that N95 masks were more effective than the surgical masks in preventing infection. Okay, so let's say that now you're a believer and you're gonna wear a mask. It's still important that you use it correctly. Take the mask and stretch it out like an accordion so it could cover both your mouth and your nose. If I can see your nostrils, you have it on wrong. Make sure the strip of the mask with the metal lining is going up on the bridge of your nose instead of upside down where your chin is. Pinch that metal part over the bridge of your nose so it fits snug and does not slide down. And when you're in a building with others, wear it the entire time you're in that building. If you wear it sometimes and then take it off other times, then you just defeated the purpose of the mask in the first place. Obviously, if you eat or drink, you will have to remove it, but by then you should be 6 feet away from anyone else or potentially even outside. Do not take it off to talk. This is actually the time when it's most important to have it on because you're blocking those particles that come out of your mouth when you're speaking. In terms of whether or not to wear it outside, if you're within 6 feet of other people, then yes, you probably should, even though the risk is lower than being indoors. Even if you're not within 6 feet of others, but you are doing something like biking or exercising on a busy trail, just think about how hard everybody else is breathing out there. You'll be more likely to pass through the air that they were just breathing out of, and they might be expelling even more particles than usual. At the end of the day, just keep in mind that the mask is not just to protect yourself, but to protect others around you. Best wishes to you and your family. Thanks for watching, and peace out.